medicinal cannabis can be useful for treating chronic pain, and specifically chronic neuropathic pain conditions. Those are conditions like HIV neuropathy or diabetic neuropathy, or even pain and spasticity from multiple sclerosis. There's no mandate yet that says, okay, the insurance company needs to pay about 50% of this, or all of it. Or, hey, let's get the pharmaceutical company, for example, to provide this for free. Those aren't there. In my experience, over 17 years or so, most patients in chronic pain who are on opioids are not abusing them. It can happen actually quite quickly in the form of hours or even several days. And what you're going to see is your child progressively getting weaker.
Let's talk about this drug. Esketamine.
Yeah.
It's a chemical cousin of an anesthetic and the party drug ketamine. But people are saying that this represents a major breakthrough in treating depression. Why? Why is it such a breakthrough?
Well, I mean, we haven't had a treatment for depression since Prozac was introduced in the late 1980s, I think. And for patients who have severe depression, who are suicidal, we really don't have many options, and this is one of them.
Why? What is so different about it?
Well, it works differently from, say, the Prozac types of medications. It works in the brain. It elevates levels of dopamine. It also works on an interesting receptor called the NMDA receptor, which is involved in pain and also depression.
Well, because it has similarities to Special K, as it's known on the street, the party drug, there is concern that this drug could be very badly abused.
It could be, but this drug is going to be very much controlled, unlike, say, OxyContin, unlike ketamine. I mean, this is only going to be available in doctors' offices, and certain doctors can prescribe it, and only patients can receive it if they're in the office.
Explain what the benefit would be in terms of having a drink laced with cannabis.
You know, I don't see a health benefit to this at all. I think this would do a disservice to our public health. You know, what they're talking about is placing a cannabidiol, which is a certain form of cannabis, a cannabinoid actually, in Coca-Cola products. And remember, Coca-Cola products are consumed by, you know, kids, teenagers, all the way to older adulthood. So I can't imagine exposing the entire population virtually to a cannabinoid product. I mean, we need much more research on cannabidiol as it is for pain control, much less liberally putting it in Coca-Cola products for global consumption.
President Trump has said he's going to do more to fight back against the opioid epidemic. Do you think he's doing enough?
I don't think he's doing enough quite yet. I mean, I saw that report. I was encouraged by it. I think he's interested in helping reduce the deaths related to opioids. And I think to do that, we need more effective substance abuse treatment centers and more centers that are affordable, because right now many are not affordable. They're very expensive. I think also what he needs to do is to make sure that we come up with a greater research budget for understanding and treating the disease of chronic pain. Because remember, I mean, there are about 116 million Americans who suffer from chronic pain. I mean, it's huge. It's a third of the population. So I feel like he's taking steps in the right direction, but we need more.
How severe is this problem with teenagers and vaping and e-cigarettes?
Well, I think it's extremely severe. I mean, along the lines of, frankly, the chronic pain epidemic. I mean, more and more teenagers and young adults are vaping e-cigarettes, and it's dangerous, frankly. And I think that many young adults who are using e-cigarettes don't appreciate the danger associated with nicotine.
And because it's got nicotine in it, there's still an addictive quality to these products, right?
Absolutely. I mean, nicotine in and of itself is quite highly addictive, and I think we've known this, you know, for many, many years, frankly. So there are a lot of different effects associated with nicotine. Namely, when you ingest it, it releases dopamine in the brain, and dopamine is the pleasure neurotransmitter. And this is what fuels the addictive qualities of it.